Today, we are diving into a medical marvel that honestly sounds like it's straight out of science fiction: tissue expansion. We're going to break down how surgeons can literally grow brand new skin right where it's needed most.
So let's just start with this question. Think about it. Imagine having a large burn, a scar, or some kind of defect that needs to be repaired. Now, what if instead of taking skin from another part of your body, creating a new wound, you could just convince your own body to create a perfect brand new patch of skin, right on demand? Well, that's the incredible problem that tissue expansion solves.
Okay, here's our game plan for this explainer. First, we'll talk about the main goal here. Then, we'll get into the amazing science of how skin can even do this. We'll look at the tech that makes it possible, walk through the actual procedure step by step, and finally, we'll lay out the pros and cons.
So, the #1 challenge in reconstructive surgery is finding replacement tissue. You need it to be a perfect match. The right color, the right texture, the right thickness. And the absolute brilliance of tissue expansion is that it uses the patient's own healthy skin right next door to create that perfect flap. That means a seamless match, and you're not creating big new scars somewhere else.
So, how in the world does this work? Well, it all comes down to the incredible biology of our skin. You have to remember, skin isn't just some static covering. It's a dynamic, living, breathing organ that has this amazing ability to respond to force and tension. This whole section is about how we can harness that natural power.
The key concept, the secret sauce, is something called viscoelasticity. So think about it like this. Imagine you're stretching a piece of saltwater taffy, or maybe some pizza dough. When you first pull it, it stretches right away, right? But if you hold that tension, it starts to gradually elongate and thin out, and it permanently changes its shape. Our skin behaves in a really similar way, and that's the property surgeons are taking advantage of.
And this stretching actually happens in two distinct phases. First, you've got mechanical creep. That's the immediate stretch. It happens right away. The collagen fibers in the skin just straighten out. But here's where the real magic happens: biologic creep. When that stretch is held for weeks and weeks, the body actually responds by generating brand new skin cells. So this isn't just stretching out the old skin, it's true bona fide cellular growth.
And this graph, it just visualizes that process perfectly. You can see that immediate elastic response happening in seconds, and that's followed by mechanical creep over minutes to hours. But look at that big curve on the right, the one labeled growth. That's biologic creep. That's the good stuff, happening over days and weeks. That's the brand new tissue we're looking for.
Okay, so we get the science, but what's the tool? How do surgeons actually apply that constant, gentle pressure to kickstart this growth? Well, it's done with a device that's surprisingly simple, but totally brilliant: a tissue expander.
Basically, think of it as a small, inflatable silicone balloon that gets placed right under the skin. It's got a rigid base to make sure the stretch goes in the right direction, it comes in specific shapes for whatever part of the body you're working on, and there's a tiny port where a surgeon can inject sterile saline to gradually inflate it week by week.
And check this out. It shows you just how important the design of that balloon is. The shape directly impacts how much new skin you can actually grow. A rectangular expander is by far the most efficient. It generates 38% of its surface area is new tissue. Compare that to a round one, which only gets you about 25%. It's basically applied geometry for regenerating your own skin. Pretty cool, right?
All right, so how does this all come together in the real world, in a hospital? We've talked about the science and the tech. Now let's walk through the actual procedure, kind of from a patient's point of view.
The whole journey really breaks down into 3 clear phases. First, there's a surgery to place the expander. Second, you have a period of several weeks where the gradual expansion happens. And finally, there's a second surgery to remove the device and use all that brand new skin to do the reconstruction. This image shows you that crucial first step. So you can see the defect that needs to be repaired on the left. And on the right, the surgeon has placed the expander under the healthy skin right next to it. The idea is to grow the new tissue as close as possible to where you're going to need it.
Now, this is not a quick fix. The expansion phase is definitely a marathon, not a sprint. We're talking 6 to 12 weeks of regular visits to the clinic. And at each visit, a little more saline is injected into the port, slowly increasing the volume. That slow, gradual pace is what allows for that biologic creep we talked about, the creation of new cells, new blood vessels, and new tissue.
What's so amazing is that this isn't guesswork. Surgeons can figure out exactly how much new skin they've created. They just measure the circumference over the top of that expanded dome and then subtract the width of the expander's base. And that difference, that's the length of new skin they have to work with. It's so elegantly simple. So now that we've seen how it's done, let's take a really balanced look at the outcomes. Why is this technique so incredibly valuable, and what are some of the potential downsides that patients and doctors really have to think about?
On the one hand, the advantages here can be absolutely life-changing. I mean, we're talking about getting a perfect tissue match, the same color, texture, and feel without creating another huge scar somewhere else on the body. That is a massive win. But on the flip side, this is not an easy road. It is a major commitment, it's a long process, it takes at least 2 surgeries and lots of trips to the doctor for those expansions, and for several weeks, the patient has to live with a very noticeable growing bulge under their skin, which can be tough, both physically and emotionally. It's really a trade-off between an incredible final result and a difficult journey to get there.
So where does this technique really make a difference? Well, the applications are incredibly broad and, honestly, often transformative. For someone who's had a mastectomy, tissue expansion is a cornerstone of breast reconstruction. It helps restore a sense of wholeness. For a child with a severe burn on their scalp, it can mean being able to grow hair again. It's used to remove large birthmarks that might carry a future risk, or to repair really complex facial injuries. In every single one of these cases, it's about so much more than just closing a wound. It's about restoring form, function, and a person's confidence.
And of course, no surgical process is completely without risk, and it's really important to be realistic about the potential complications. A lot of them are minor, things like manageable pain or temporary changes to the skin's shape. But more serious issues can happen. There's always a risk of infection or bleeding under the skin called a hematoma. In some rare cases, the expander itself can leak or even break through the skin. Now, surgeons take every possible precaution to prevent these things, but they are real possibilities that every patient has to carefully discuss with their doctor.
And so that brings us full circle. This quote just perfectly captures the essence of the whole thing. This isn't about inventing something unnatural. It's about deeply understanding a fundamental property of our own bodies, our skin's ability to stretch and adapt under stress, and then cleverly using that property to heal and reconstruct.
It's just such a powerful idea, isn't it? Using a mechanical force to stimulate biological growth. And it leaves us with this final thought. We've seen how this works for skin. So where else in the body could we apply this principle of guided regeneration? What other tissues could we, convince to grow on demand? The possibilities are really, really fascinating to think about.